Grazie anzitutto.
I wish, first of all, to thank for the kind invitation. I wish to talk to you about my experience with dark procedures, especially when the big bubble isn't or cannot be formed. And I believe that DALK is the best procedure when it comes to treating keratoconus in particular, but also corneal dystrophies, and most of all, herpetic keratitis. So the surgical techniques that have been proposed are many. My favorite one is the visco bubble, because we can remove the whole of the stroma quite safely, first of all by injecting air and then replacing air with viscoelastic. In such a way, we can remove the stroma without causing any ruptures in the decimet, and we can put the donor cornea on top of the recipient cornea quite safely. But what happens instead when the big bubble doesn't appear? Uh, So in many cases, this might happen. Why is it so? First of all, because probably we haven't cut deep enough. The deeper the cut, the more easily the big bubble will be formed. In case of a failed big bubble, I resort to another procedure or technique, which is micro bubbles. I try and cut with the blade micro bubbles in the stroma, and then with the viscocanalostomy cannula, I try to inject viscoelastic and cut until I find the micro bubbles on top of the decimet. And then I can insert the cannula in the plane between the stroma and the decimet. And sometimes we might encounter here the dua layer, and sometimes we may separate the dual layer from the decimet, but one should be very careful because you can easily rupture the decimet, as it happened, for instance, in the case you're washing right now. If it's a small rupture, you only have to put on top so the donor on top, and then filling the chamber with air, and the outcome will be, however, good. But sometimes we do not have a big bubble, as it happened here. We only have a small bubble. And so by inserting viscoelastic, we can increase the separation between the stroma and the decimet, and in this way get a good outcome in a short time. But how could we manage dark in herpetic keratitis? In my opinion, we might obtain equally good results by using air injection. Also, because air can help us stop bleeding. So we can, however, remove by means of microbubbles the stroma. We can find the decimet and then remove the whole of the stroma and obtain, in these difficult cases, a good outcome. Here, in the second case, there was also the decimet oculi that has somehow helped us because by using a viscoelastic starting from this area, we succeeded in separating the stroma and then proceed with the cornea transplantation. So what do we do in specific cases? So what to do here? Here I've used a needle, but I've made a mistake because I've injected air directly into the anterior chamber. and I have applied some cyanoacrylate to close the decimate rupture, and then I have removed the residual part of stroma, and then with on top the cyanoacrylate. And in this way, I succeeded in finishing my DALK procedure, but this something that I failed to obtain in another case of hepatic keratitis where I had a hole and I couldn't really realize whether the hole was on the decimate or the dual layer. Actually, the hole that you see here close to the cannula was in the decimate, whereas I have ruptured the decimate, and then the rupture actually expanded, and at that point I couldn't but convert to PK. So I performed a PK, but the patient, however, obtained a good visual acuity as a result. So why going for a dark, considering the long learning curve? The surgical time is however long, and there might be surgical complications, and the final outcome is not necessarily great. So I have analyzed a number of cases that I have been following up for a very long time. It's 33 eyes in 30 patients, and at 12 months and 30 months, the visual acuity was very good. The patients who received the big bubble had 8/10 in terms of Schnellen lines, with the micro bubbles a bit more than 7, a bit more than 7/10. So I can conclude that DALK can provide very good outcome, and that the DALK procedure with a big with a big bubble isn't that different from the micro bubbles or the pre-decimate